start with some images here of the cadavers and models, and then I will break us off into a few groups and look at some practice activities, okay? So this week we're looking at the heart, which is really in the mediastinum. And so we describe the mediastinum as being the central region bordered by both of our lungs on either side, and then by the sternum anteriorly and the vertebral column posteriorly. So kind of this really small, tight space where the heart is located, and some of the great vessels here. So starting off, some of the first set of structures we can see here are some of these major vessels that are going to the head and neck, or draining from the head and neck respectively. So we've got the carotid here. So this is the brachiocephalic trunk. All right, I'm just gonna put brachiocephalic trunk. And then that will divide into the common carotid here on the right. So right common carotid. And then we have a similar thing happening on the left, but the difference is that the common carotid and the subclavian both come from the arch of aorta. So that's a really important sort of asymmetry that we see in the mediastinum in these great vessels. We've got, because the arch goes to the left and then curves downward, it's just easier for the left structures to come immediately off of the arch. So we've got the left common carotid here. And then we've got the left subclavian, which is a bit hidden behind this vein that I'll talk about here in a minute. Okay, so that's a bit of asymmetry that we see. We've got one common brachiocephalic trunk, then dividing into right common carotid going to the head, and right subclavian going to the upper extremity, whereas those two vessels come immediately off of the arch on the left. And so what that means is that there is no brachiocephalic trunk on the left. There's only one brachiocephalic trunk that divides into the right structures. And then as far as the veins in this region, the superior mediastinum here, we've got the internal jugular vein. We talked about this last week. All right, it's going to communicate with the subclavian vein here. So this is the left internal jugular vein. We've got the left subclavian vein. And those two communicate to form the left brachiocephalic vein, okay? So there's a longer left brachiocephalic vein, again, because of that slight asymmetry in that this structure has to cross the midline and communicate to the superior vena cava, which can be seen here, all right? Whereas the right brachiocephalic vein, so here's the right brachiocephalic vein, is also draining the right structure. So it's going to drain the right internal jugular here. That's kind of been cut in order to remove the heart, but that's this structure here, as well as the hidden right subclavian vein. Those two structures communicate to the right brachiocephalic vein and then to the superior vena cava. It's just that the left side is a bit longer, having to cross the midline. All right. Getting deeper into the mediastinum here, we can see the fibrous pericardium. So all of this is fibrous pericardium. In other words, that pericardial sac, very similar to the pleural sac in its location and its function. It's got that double-walled membrane with a thin amount of fluid in between for lubrication as the heart moves. And so we can see that here covering the heart. Here's another view of the fibrous pericardium. So this thick wrapping around the heart, right? All of this is fibrous pericardium. And then we can also see some of those posterior structures we talked about last week, such as the phrenic nerve. Now, I stressed a lot on the phrenic nerve last week, phrenic and vagus, just because we introduced the thoracic region, and that was, you know, those are structures that we can see, but the phrenic and vagus are also on your list this week. So don't forget about those structures, and I'll be pointing them out here as well. And then again, the diaphragm here for reference. So here I'm retracting the pericardium, and we can really start seeing the heart structures. We can see the cut surface of the aorta. So here's the aorta becoming that arch and giving off those branches that I just mentioned. Here is the pulmonary trunk. So here's pulmonary trunk. And it's then going to divide. It kind of dips underneath the arch and gives off the right pulmonary artery, or excuse me, the left pulmonary artery here. And then the right pulmonary artery going to the right side. And so we can speak about our chambers here based upon the location of these two vessels. So again, here's aorta. So this is going to be our right ventricle. This is going to be left ventricle. Right atrium is going to be over here where we can really see the right auricle of the right atrium. And so when we look at the heart, the way it sits in the thoracic cavity, what we see immediately is called the sternocostal surface. So the sternocostal surface is made of the right ventricle. This is the area that sits right beneath the sternum and the costal cartilage. And then we've got the apex of the heart, which is this lateral left leaning projection here, this pointy tip, mainly formed by the left ventricle. Right, so this is left ventricle. And then we've got the base of the heart, which is where we have the major vessels and the atria. So the top of the heart, where we've got these major great vessels leaving and entering, depending on your perspective here. So we've got the aorta and the pulmonary artery, and then the other superior vena cava, etc. And all of that forms the base of the heart. So another view here, we're looking at the posterior mediastinum, but sort of from a left lateral position where the heart has been removed, and we can see the remnants of that pericardial sac here. Okay, we can also see the cut surface of the arch of aorta. So here's that cut surface of the aorta. Here's that branching of the arch. And we can also see the branches of the vagus nerve. So I always talk about vagus nerve in reference to phrenic nerve because they're just in such a similar position, such a similar spot. And so here's the phrenic nerve running off more laterally to the side. Here's the vagus nerve. And so we spoke about the vagus nerve giving off this branch called the recurrent laryngeal. And on the left side, the recurrent laryngeal wraps around the arch of aorta. So here's that branch, and then here's the rest of the vagus descending posterior to the heart, posterior to the esophagus, and the trachea and so on. Okay. Another view of the superior mediastinum here, just reiterating those vessels on a different cadaver here. So we've got the common carotid, left common carotid here. Okay, we've got the left, oh, excuse me, I'm mixing the sides up here. This is the right common carotid. All right, so we've got the right common carotid on that side. Right, so right common carotid artery here. Right internal jugular vein here. We can also see the brachiocephalic trunk. So this is the right brachiocephalic trunk, that main stump coming from the arch. So here's the arch of aorta. Here's that first branch off the arch, the right brachiocephalic trunk. And then it divides further into right common carotid artery. And then we can sort of see that right subclavian sort of dipping deeper into the mediastinum there. Okay, it's going to head out toward the axilla, where it gives blood supply to the upper extremity. And we can see a similar thing happening with the veins, right? So we've got the right internal jugular vein combining with the right subclavian vein. So here's a little bit of that right subclavian vein here. And both of those conjoin to form the right brachiocephalic vein. Okay, I'm just kind of putting some mnemonics here, just some letters just to represent these vessels, okay? And then on the left side, we've got the left common carotid. So going deeper here or more medial here, left common carotid artery, all right? Left internal jugular vein, internal jugular vein. And then we can also see the left subclavian vein. Now, left internal jugular vein and left subclavian vein branch to, or converge together rather, to form that left brachiocephalic trunk, or left brachiocephalic vein, excuse me. The trunk is only on the arterial side, okay? And then left brachiocephalic vein and right brachiocephalic vein converge to form superior vena cava, okay? And that dumps into the right side of the heart. So just trying to really label out those vessels and how they kind of merge and branch to supply or leave the heart. Another view of the anterior mediastinum. Now, I wanted to use this to kind of point out where the thymus would be, but in honesty, the thymus is not very visible on our cadavers. It's usually a hit or miss structure. Because of the age of most of our cadavers, it's not very visible, but it's usually entangled with the fat or connective tissue that's on the anterior surface of the pericardium. So this is where we would kind of see the thymus, but in actuality, it's not very visible, and don't expect to be tested on a cadaver image with the thymus. But I want to point out where it would be anatomically in a younger adult. I think last semester we had a 40-year-old cadaver, and we had a quite, nicely preserved, decent sized thymus. But this year we have some older cadavers, and so we don't have much of that thymus preserved. All right, so retracting this pericardium again, we can look at some of these deeper structures. And so what we're seeing here is this very large right atrium. And I'm going to talk about some of the abnormalities in this heart, because this heart was a 90-year-old cadaver, very old, a lot of cardiac abnormalities, and I'll talk about those later on. And so this is why this atrium is so enlarged. I'll talk about why later on. But then we can see the right coronary artery here. So this is what would be the coronary sulcus. Remember, coronary sulcus is the groove that separates the right atria on top from the ventricles underneath. And so that is the coronary sulcus. We've got the right coronary artery branching from the aorta. So here's the aorta, slightly deeper here. And then we can see the right ventricle a little bit here. Now, again, I've removed the heart so we can really see the posterior mediastinum. We've got the phrenic nerves on the lateral aspects descending down into toward the diaphragm. We've got the bronchus that are coming off of the trachea here. So left main bronchus, right main bronchus, and then the connections to the lungs. Another view of the posterior mediastinum without the heart. And so I'll point out some of the vessels we talked about here again. So we've got the brachiocephalic trunk. So here's that brachiocephalic trunk. So right brachiocephalic trunk that then branches into right common carotid artery and right subclavian artery. The second branch on the arch of aorta is the left common carotid artery. And then the third branch is the left subclavian artery. Okay. So this is going to the head on the left, this is going to the upper extremity on the left, and then both of those branches on the right come from the right brachiocephalic trunk. And then other structures we can see in the posterior mediastinum are just the phrenic nerves running laterally. But then again, comparing the phrenic nerve to what's happening with the vagus. So here's the vagus more medially, and then the branch that the vagus gives off, that left recurrent laryngeal, wrapping around the arch of aorta on the left. And I'll talk about what it wraps around on the right on a future slide. All right, so another view of what's happening here. So here's our arch of aorta quite nicely. Here's that main trunk, that right brachiocephalic trunk. Here's that right common carotid artery going up to the head. And then here's that right subclavian vein sort of dipping more posteriorly toward the right upper extremity. On the center, or the other two branches, are the left common carotid artery going to the left side of the head, and then the left subclavian going to the left upper extremity. And then we can also see that bit of the fibrous pericardium here as well, a bit of the phrenic nerve here as well. Yep. So another view of the posterior mediastinum, so the phrenic running laterally here. And then here's the vagus. Now on the left side, on the right side, because there is no arch of aorta on the right, the recurrent laryngeal actually wraps around the right subclavian artery. Okay, whereas on the left side, the recurrent laryngeal is wrapping around the arch of aorta. So again, another bit of asymmetry that we see because of the skewed nature of the heart and some of these vessels. We can also appreciate the bronchi here, branching from the trachea. We can also appreciate the esophagus. So there aren't many good views of the esophagus because it's so hidden behind the trachea. So here's that muscular tube, which is the esophagus, which is usually very collapsed behind the trachea there. Okay, so we're going to get into some of the heart structures themselves. So the vessels, some of the internal structures, and the chambers and so on. And so we're starting off with an anterior view of the heart here. And so once again, we've got our sternocostal surface, which is really formed by right ventricle, like the most anterior aspect of the heart that sits posterior to the sternum. We've got a little bit of our apex here, right? So this would be apex. Our base is all of this, so mainly our atria along with the great vessels. So this is all base up here. And then we've got the right border of the heart, which is coming in contact with the right lung, essentially, and then the left border of the heart coming in contact with the left lung. Some of the main vessels we can see here are the aorta, so the base of the aorta before it actually arches. And then we can see the pulmonary trunk, so the main pulmonary trunk, which will then divide into right and left pulmonary arteries, which are giving that deoxygenated blood to the heart. And so we talked about the sternocostal surface being formed by right ventricle, the apex of the heart and the left border being formed by left ventricle. And so we can really appreciate that sulcus here, which is really the separation between our two ventricular chambers. This is called the anterior interventricular sulcus. And this is that groove that is demarcating the right ventricle separate from the left ventricle. It's also going to represent the deeper structure which separates these two ventricular chambers, which is the interventricular septum. And I'll show where that is internally. I also want to point out the coronary sulcus, which again is the demarcation between atria on top. So these are all atria. More so the right atrium, the left atrium is hidden sort of posterior to our main vessels here, and the ventricles beneath. So the sulcus, coronary sulcus, separates atria on top from ventricles on the bottom. Here's an internal view of that heart. And this is the heart that I mentioned that had a lot of abnormalities. Some are sort of cool in terms of the clinical correlation, and so I'll point those out. But then some of them really just distort the natural anatomy. And I really want to point that out as well. So we've got the bicuspid valve. And what we're seeing here is a replaced bicuspid valve. So this is a valve-like apparatus that has this flap-like opening here. That is a mechanical valve that is replacing the mitral or bicuspid valve on the left. And so this is the left atrium up here. And the left ventricle would be beneath this structure, but essentially this patient had a mitral stenosis, and this is where the mitral valve becomes very fibrotic, very calcified, very stiff, and so in order to preserve functioning, we have to replace that valve. Another abnormality on this same heart was the stent placed in the aorta. So here's that main aorta. So this is a superior view looking down. And here's the aorta, and here's that stent, this kind of fence-like or cage-like structure that was again placed to keep the aorta open and patent, because again, when we get into this cadaver was I think 90 or 90 plus. And so when we get into those older ages, it's kind of natural to see the calcification of the connective tissue that makes up our valves. And so they usually become very stiff or fibrotic. And to keep them open, we have to usually mechanically replace them. Here's another view of this same heart. And again, a consequence of the stenosis. So here's that valve that was once very stenosed, but it's now been replaced. Here is the consequence of that, a very, very, very thick ventricular wall. So this is not normal at all. This is a very thick ventricular wall. And this is created because of the resistance that the left ventricle has to work against with that stenosis of the aorta. So when the aortic valve becomes very stenotic or very fibrotic and calcified, it just puts more pressure, more effort that this ventricle has to exert in order to overcome that resistance, on top of the already high resistance that is seen in the systemic vasculature. Okay, and so we can see this happening. This is called cardiac hypertrophy, which means that the muscle gets very thick. And so this is a problem not only because, as we can see, it makes the chamber very small. And so it's going to impede the heart's, the ventricle specifically, its ability to relax and fill, and therefore impede its ability to eject adequately, because all of this chamber is really just filled with this bulky muscle. All right. And just to point out some of the left structures, the right structures here. So this is on the left. This is left ventricle. This is on the right. And we can see the large difference between the two sizes of these chambers, and then the thickness of the muscle on either side is what I'm trying to say here. Now, I'm not going to point out the wall structures on these cadavers, although we can kind of appreciate them here. So the papillary muscles to some extent here. But then because the chamber is just so distorted, those other structures such as the trabeculate carne and the chorda tendineae are not very clearly appreciated on this heart. All right, so let's get into some of the other external heart features, mainly the coronary arteries and then those grooves, those sulci, and then some of the major vessels we can see as well. So here we got a posterior view of the heart. We can see a bit of that coronary sinus here. This is actually more of a left lateral view. So excuse this labeling, this is wrong. This is more of a left lateral view. We can see the major vessels. So this is the pulmonary trunk branching into pulmonary artery on the left and then pulmonary artery on the right. Here's the arch of aorta skewing to the left. And so this is really a left lateral view of the heart. This is mainly the left ventricle forming the left border. And as far as the vessels we can see the left coronary artery coming right from the aorta. So it's actually coming from the aorta here, but it's going to be traveling behind the pulmonary trunk here and then giving off this branch here. And so we can see the left anterior descending branch of the left coronary artery. This is also called the left interventricular artery, those terms are interchangeable, as well as the great cardiac vein here. So this is the great cardiac vein running alongside the left anterior descending artery, which are then residing in the anterior interventricular sulcus. Okay, we can also appreciate the cardiac sinus, which is the major vein that drains into the right atrium, as well as the left marginal artery. Again, because we're looking at a left lateral view, we can nicely see that left marginal artery. Here's an internal view of the right atrium where we can appreciate the crista terminalis, so the smooth part of the wall only found on the right is called the crista terminalis, whereas the sort of ridged portion of the wall is the pectinate muscle, okay? And then we can also see the kind of the opening of that right atrium there. The left atrium is on this side, but it's not easily visible just because of its close attachment to the posterior pericardium. And so it's not usually well preserved as we dissect away that pericardium, but I'll point out an area where we can see it a little bit better. Another view of the internal surface of the right atrium. Here we can see the fossa ovalis, which is the fetal remnant of the foramen ovale. So this is what's left back when that opening that was once the communication between right atrium over here and left atrium, which is kind of on this side. And so that communication was needed during fetal life in order to bypass circulation to the lungs. And so blood that enters the right atrium will just go right through the middle of the heart and enter the left atrium through that septal opening, which is the foramen ovale. And then the adult remnant is called the fossa ovalis. Okay, while we're looking at the back of the heart, so this is the back of the heart, posterior view of the heart, I want to also point out some of the coronary vessels that we can see here. So here is the posterior descending artery, also called the posterior interventricular artery. This is residing in the posterior interventricular sulcus. So again, that groove separating the left ventricle here from the right ventricle here. Running alongside the posterior descending artery or posterior interventricular artery is the middle cardiac vein. Okay, and middle cardiac vein is another one of those veins, those tributaries that's leading towards the coronary sinus, which is this large vein at the base of the left atrium. So this is left atrium here. Another superior view of the heart here. So we can see the arch of aorta quite nicely, those three main branches that we've spoken about. Here is the right auricle, right, which is that accessory or appendage of the right atrium. Here's the right coronary artery that's leaving that aorta. So this is going to the right side of the heart. It's then going to give the right marginal artery, which is going to be running along the right margin of the heart. I'm actually pressing my finger against the right ventricle here, which is again is that sternocostal or anterior-most surface of the heart. And then we can also appreciate the pulmonary trunk. So here's that pulmonary trunk that is then going to branch into pulmonary artery on either side. And then the right pulmonary artery really dips underneath the arch of aorta there. All right, so on this view, this is a normal heart. So again, I want to differentiate this between what we showed earlier, where we had that really thickened left ventricular muscle. This is more of an appropriate size for the heart muscle or the heart wall, excuse me. And so we can nicely appreciate the papillary muscle. So these finger-like upward projections, you can see them here on the right as well as the trabeculae carinae. So the trabeculae carinae is really the ridged part of the ventricular wall itself, okay? And then differentiating those two structures from the chorda tendineae. So these fibrous or connective tissue attachments to the valves. So here's that valve, a little bit of that valve there is what we call the chorda tendineae. So the order or sequence of these structures is the trabeculae carinae coming from the wall, the papillary muscle being that upward projection of muscle, and then the chorda tendineae, which directly connects to the valves. We can also appreciate the interventricular septum. So again, that wall or muscle that divides the right ventricle over here from the left ventricle over here, and is also representing the groove on the anterior surface of the heart, which is the interventricular sulcus. All right, another view of the internal part of the heart, again, papillary muscle projecting upward or inward toward the chamber there, trabeculae carinae being the ridged part of the wall, and then a little bit of that fibrous cord, which is the chorda tendineae, which are really these white structures that connect to the valves. And then we can also see that interventricular septum, which divides our chambers as well. So here's a posterior view of the heart. Again, the things we can see in the posterior view. Now remember, the laterality is going to change from this posterior view. And one of the easiest ways that I can sort of guide you in determining the posterior view, although that would be given, right? We're going to try to give that on the quiz just so you have an easy reference, but also look for the great vessels. On an anterior view of the heart, you're going to see more, let's kind of jump back here. You're going to see more of these great vessels that are leaving the right ventricle, right, the pulmonary trunk, and leaving the left ventricle, the pulmonary artery. You're also going to see more of the auricles. So that's kind of an easy tidbit to differentiate when you're not looking at the right, or excuse me, the anterior part of the heart. So looking at the posterior part of the heart here, we've got the left ventricle, which is now on this side, right ventricle on this side. Those two structures that I talked about here, so the posterior descending artery, slightly lighter in color, the middle cardiac vein, slightly darker in color, and then this is that posterior interventricular sulcus where those two structures reside. Also, we can appreciate the cardiac sinus here, or coronary sinus, excuse me, and that is the major vein that is draining to the right atrium. So it's going to actually loop across the inferior aspect of the left atrium, which is this structure here, and then communicate directly into the right atrium on this side. Okay. Here's a left lateral view where we can see some of those left structures. So the left marginal artery coming off of the left circumflex. Now the left circumflex is sort of hidden beneath the vein here, and I'll point it out a little bit later. Here is the right side of the heart. So again, thinking about how the left view of the heart differs from the right view of the heart based upon what we can see as far as these great vessels. So here's that right ventricle. All right. Here is the pulmonary trunk here, and then the arch of aorta. Right. Here's another view, but this is a straight on view, an anterior view. Again, we're seeing the pulmonary trunk, arch of aorta, the right auricle, the right ventricle here, left ventricle here, the anterior interventricular artery, which is this lighter color here, and then the great cardiac vein, which is usually accompanying, is not as visible from this view, but then we can see some of the right coronary structures, which are giving blood to the right side of the heart. Okay. Here is another one of those fetal remnant structures. So this is the ligamentum arteriosum. This is that connection that used to exist between the pulmonary trunk under here and the arch of aorta on top. So again, this is functioning in order to bypass the fetal lungs and send blood from the right side of the heart immediately back into the systemic circulation, since the lungs are not functioning in utero. And so the ligamentous remnant is called the ligamentum arteriosum, which still is visible on all adult hearts. Okay, here's another left lateral view, and we can appreciate the left marginal artery running along the left margin of the heart here. We can see the left anterior descending, running into the anterior interventricular sulcus. Here's a continuation of that, going all the way down on the anterior part of the heart. So here's the anterior, this would be posterior, and what we're looking at is the left lateral view. Now I want to point out the circumflex. So the circumflex, so here's that main left coronary artery coming from the arch of the aorta. Here is the left circumflex. And so the circumflex is a very short branch. It doesn't go for very long because it then gives the left marginal artery, which run along the left margin of the heart. So it's a very short sort of stump in between the left coronary and the left marginal. Another anterior view of the heart, just reiterating some of these vessels here. So the right coronary artery giving rise to the right marginal on that side. And then the right coronary artery, here we can see the left coronary artery, excuse me. So right coronary artery, left coronary artery, the anterior interventricular, otherwise known as the anterior or the left anterior descending, and then the great cardiac vein that's accompanying. Okay, similar structures here. And then the final structures I'm going to go over here are some of the models which have sort of a better view of some of these structures. So the right auricle, the left auricle, the pulmonary trunk, which is then dividing again into pulmonary arteries on the left and right, that ligamentum arteriosum that I showed earlier. Here's the arch of aorta. Here is the superior vena cava, which is receiving communication from the left brachiocephalic vein along with the right brachiocephalic vein, okay? Here is the sternocostal surface of the heart formed by the right ventricle. Here is the anterior interventricular sulcus or groove, which has the left anterior descending, otherwise known as the anterior interventricular artery, as well as the great cardiac vein. Here is the left ventricle, which is really the apex of the heart. There's a posterior view where we can really see the coronary sinus here, that main vein that drains all of the blood from the coronary vasculature. Here is a cut surface of the inferior vena cava communicating to the right atrium, right? Here is left atrium. Here again, because we're looking at a posterior view, this is going to be right ventricle, and this is, this is going to be left ventricle, pardon me, and this is going to be right ventricle. Here is the posterior interventricular sulcus, right? And that has the middle cardiac vein along with the posterior descending artery, otherwise known as the posterior interventricular artery. Okay, and remember that artery is a branch coming from the right coronary. So we can see it looping around the base of the right atrium here, or the coronary sulcus, right? This is all coronary sulcus, and communicating to branch into that PDA or the posterior interventricular artery. And I'm intentionally mentioning both of these terms just so that you're not confused, because both of these terms are on your list and they're both acceptable on your quiz or exam. Here's a close-up view of the right coronary artery, just so you can really get an appreciation of that right marginal artery, which branches onto the right margin of the heart. So right coronary artery here, and then right marginal artery. And then here is the small cardiac vein. So the small cardiac vein is not very visible on the cadavers, but this is where it is located along the right margin of the heart, running with the right marginal artery. Here's the back of the heart where we can really see those 4 pulmonary veins. So this is all left atrium here. We've got the superior right pulmonary vein, the superior, the inferior right pulmonary vein. So let's actually label these out. Right superior pulmonary vein, right inferior pulmonary vein, left superior pulmonary vein, and left inferior pulmonary vein. All 4 of those veins dumping back blood into the left atrium, which is coming back from the lungs, okay, on either side. We can also see a cut surface of the aorta and then a cut surface of the pulmonary arteries branching from that pulmonary trunk. And lastly, we'll look at some of the valves here. So we can see all 4 openings or all 4 valves, the aortic valve here, the pulmonary or pulmonic valve here, the tricuspid valve on the right, the bicuspid valve on the left. Here's that left atrium. And you can see one of those veins, right, the superior, right superior pulmonary vein dumping back into that left atrium. And then this is all right atrium on the right side. We could also appreciate the main coronaries coming from the aorta. So right coronary artery and left coronary artery. And then again, left coronary artery divides into left anterior descending or left anterior interventricular, and then the left circumflex, which is the short branch, communicating to the left marginal. All right, and then just an internal view of some of those structures on the model here. Pulmonic valve, bicuspid or mitral valve, right, interchangeable, and then tricuspid valve, our interventricular septum here, papillary muscles here, trabeculae carni being the actual wall here. These are the tendinous cords or chorda tendineae. Here's left ventricle, here's right ventricle.